afternoon, everyone, and thank you for joining another Superior Health Quality Alliance Roundtable conversation. My name's Kim Heft, and I am joined here by my colleagues, Kelsey, Jerry, Jill, and our guest speaker today, who is Tracy Field. Welcome back to those that have been with us for over the last several months. But if you are new to this call, we host this session each week. And the first 30 minutes is our educational session where we highlight important topics related to COVID-19, vaccinations, boosters, and other nursing home related topics. And then the other half, the remainder of the time, is devoted to a Q&A session. There's going to be a survey at the end of the session, which we would ask you to take just a few minutes to complete. And then we'll also put the link for the PowerPoint into chat momentarily. Speaking of chat, please share with us any comments, questions, anything that pops into your mind during the presentation, and then we'll use that for discussion in our Q&A after the presentation. So today, we are pleased to have one of your fellow peers present to the group today. Tracy Field, she's a registered nurse and the corporate infection preventionist at Ecumen, which is a nonprofit organization based in Minnesota. Tracy and the Ecumen team, just like many of you, were suddenly faced with the COVID pandemic and probably have experienced many of the same barriers and successes along the way. So Tracy's going to tell her story on how the Ecumen team tackled the COVID pandemic head on through engagement, staying connected, and transparency. So with that said, Tracy, we are so happy to have you here, and the floor is yours.
Well, first of all, thank you so much for giving me this opportunity to speak on behalf of Ecumen. They've done an amazing job during this pandemic. We've really had a lot of success with low COVID-19 cases and a lot of success with vaccination high rates. So next slide. I labeled this "When the World Fell Apart, Ecumen Pulled Together." I think we really did pull together. We created so much support for the residents, families, and the team members in so many different ways. And it really created a lot of trust, respect, and in return, we got a lot of compliance in the areas that we needed to. Next slide. Again, the low cases and vaccination success was achieved through engagement, staying connected, and transparency. Next slide. Learning objectives are review and learning strategies for engagement with team members, residents, and families to maximize compliance, and to review and learn strategies to continue strong connections with team members, residents, and families to maintain that compliance. And reviewing and discussing how connection and transparency can create trust and respect, leading to compliance. Next slide. Staying connected and focused on safety through support. Ecumen created a resource line. Fun fact, the nurses called it the bat phone. It rang 24 hours a day. It was staffed 24 hours a day by the Ecumen nursing leadership team and the COVID response team. There was also an on-call team every weekend available to support communities with COVID communication to residents, families, and team members. And this also included support from people services and operations. The resource line answered questions, every question imaginable about COVID, and helped with resources that were needed. Again, this was for team members, residents, and families. It offered a stable line of communication and it instilled trust, and it really showed Ecumen's commitment to upholding responsibility to the population that they serve and employ. The corporate response during the crisis, the initial crisis of the pandemic, was really amazing. They secured PPE supplies and ensured communities had the supplies they needed to keep residents, families, and team members safe. They created a smart sheet, and the director of nursing at each community would submit their counts on hand of each supply, and they would also request supplies. When they would request supplies, they would be shipped to the community within 1 to 2 days. It was incredible support. Next. Staying connected and focused on safety through transparency. The pandemic created so much anxiety, fear, and questions that Ecumen really did a great job in just making people feel secure. And one of the biggest things that they did was they created a template for a newsletter to be sent out to team members, families, and residents every week. And it included a lot of information that really showed the transparency and trust. And the first paragraph just always made so much sense to me. Just going to read it. We are updating you weekly with the number of confirmed COVID-19 cases among residents or team members in your community. We also will continue to update you on evolving public health guidance. We thank every one of you for continuing to follow our stringent safety protocols, which are in place to help keep all of us safe and well. We continue our dedication focused on reducing the transmission of this virus. It just means so much. Next slide. The newsletter, again, it was a template, but it had all of the information for each community individualized. And it was for residents, families, and team members. Each community would report their COVID cases for that week, and then the total COVID cases for residents and team members, COVID recoveries, and any loss of life. This transparency, I think, really made a big difference in residents and families and team members really trusting in the reports, the numbers, and there wasn't any questioning what was being done at the community to combat COVID, vaccination efforts, clinic dates, who they were vaccinating, when and where, mitigation efforts, all of the environmental services, efforts of cleaning, the monitoring of the residents, the security of the building, visitation guidelines, all of those things were in that weekly newsletter with updates. Testing requirements, who we're testing, why we're testing, when we're testing, what those results are, including guidelines from CDC, CMS, and your state Department of Health agency. And all of this really reinforced our regulations and compliance. Next slide. Staying connected and focused on safety with the use of technology. Prior to the pandemic, we have an app that's utilized by all team members. It's called Ecumen Today, and download it on your phone for quick access and also for use on computers. But once the pandemic came, it was an amazing piece of communication for team members to keep up on up-to-date information really quickly and efficiently. And we shared so many really amazing photos and updates from communities to show each other support. We created a slogan called Ecumen Strong, and showed our team members, caring for residents, caring for each other, and working as a team as COVID caregiver warriors. And I think it really gave everybody a sense of community and strength and faith. A COVID website was created for team members with up-to-date information and tools for them to use with residents and families. It just had a wealth of information and resource on it. Our team members knew that they could go there, they could find updated information, they could find action items for their community that they should be working on. A smart sheet was developed for questions to be addressed with timely response from the clinical excellence team. On that COVID website, you could submit any kinds of questions that came up and received an answer like within minutes. The COVID response team was just amazing at the response. And I was told that they received over 2,000 questions on that format. So it was a good resource for our teams. Ecumen curated a podcast with our Ecumen pharmacist and partnered with the clinical education team to talk about vaccination, hesitancy, safety, science, just to answer people's questions and get them more comfortable with vaccination efforts. Next. Staying connected and focused on safety using resources. A leader huddle on Zoom was created, hosted by the COVID response team. This created support for our leadership teams at every community level. Clear communication to the leadership teams was given, new guidance and protocols, clear communication and expectations with action items that the community needs to put in place. This was started daily. We literally had this leader huddle every single day, twice, to keep up with everything. And then that frequency scaled back as time moved on. We still do the huddles. They're about every 1 to 2 weeks, depending on new guidance that comes out. Ecumen's continued support to the entire long-term care community by the leadership team is to maintain trust and respect, acknowledge the hardships they face daily. Our caregivers have been given so much to take care of the people that we love, and their commitment has been amazing. This guides them through the pandemic as COVID caregiver warriors. Next. Staying connected and focused on safety with transparency and trust. Ecumen created a consolidated way for reporting. They created organization-wide dashboards to monitor case counts, PPE supplies, and this created the ability to monitor trends across all communities and respond to changes and allocate resources. If they saw that one community was really struggling, all of a sudden they had 5 staff members out and 15 resident cases, they would contact them and say, what can we send you for supplies? How can we help you? Can we send out our leadership team? The leadership team actually went out and helped on the floor. Creating information, putting forth the information on efforts to vaccinate and importance of vaccination, how the community is addressing staffing challenges that have been affected by COVID-19. This is an ongoing discussion for team members, residents, and families. They've put a lot of effort into retention, which I know everybody is doing right now. It's just so important that we keep everybody that we have right now on our teams because they have stayed throughout the pandemic and their commitment really shows. Ecumen created a program called Family Helping Family, and this is to support team members who have been severely affected by COVID-19. Team members have lost a lot of work time and have used up their PTO. So Ecumen has a Family Helping Family application that a team member can apply for support. And I've heard a lot of stories about team members getting their car payment paid, their rent, food, groceries, gas, just to get back and forth to work. And it's really been a high source of respect amongst our team, knowing that Ecumen really cares. They care about us, they want us to be here, and they know it's tough. Next. Vaccination compliance continues. We designed a My Why campaign, and it's a peer support campaign. We have these nice little signs that we posted around the communities where peers would explain, they would convey their reasons for vaccination and how important it is to society and also our communities and our healthcare support teams. It was really effective to see everybody's perspective and insight on that. And I think it did create a lot of success with our vaccination. We also designated a vaccine ambassador at each community. A lot of times this really worked out with nursing students that were in a program and had a project they had to be working on, so it kind of coincided with that. But a vaccine ambassador that had boots on the floor, that worked on the floor, was very convincing to the rest of our team members. And, we created special marketing materials for them to hand out. They had special connections with our teammates, and that also created a lot of success with our vaccination. Ecumen partners with the pharmacy, and we collaborated to create vaccine clinics that were set up for residents, all essential caregivers and team members, contractors that also serve residents at our communities. So all essential caregivers for our residents were vaccinated on site, which created a lot of trust, which created a lot of respect, and just continued the commitment that Ecumen has, and just really maintained that compliance that we needed. Continuous review and education regarding COVID-19 virus, PPE, vaccination, COVID testing, illness reporting, CMS and CDC and state guidance, and education and support are so key in compliance. This continues. We're always looking for new outlets on how to convey these messages and make sure that people are aware of the new updated things that are in place. A panel review of all vaccination exemption requests were developed, supporting our team members in a respectful manner. The vaccine mandate, it hurt a lot of people. It was hard to kind of wrap their heads around that and understand, why they had to get vaccinated. But the people that certainly absolutely couldn't for those special reasons, those cases were really dealt in a respectful manner. Next. Staying connected and focused on safety, consistency, and strength. Ecumen's consistent messaging throughout the organization on the importance of keeping residents, families, and team members safe has not wavered throughout the pandemic and continues. We're designing a new program that's being implemented to reinforce infection control practices, vaccination, and all things COVID and beyond. The program is called Infection Prevention is My Intention, and it will contain vaccination importance, all aspects of infection control, consistent messaging on the importance of infection control, and just really focusing on, MDROs and all other kinds of emerging pathogens. Monkeypox is here. There's other things that may come about. Next. We all know the barriers to COVID vaccination, but I just wanted to point out lack of education, knowledge, and experience, fear and anxiety, staffing challenges, PPE burnout, testing burnout, complacency, media, conspiracy, hoax, and hoax theories, daycare, school-age children. Next slide. Religious beliefs, spiritual beliefs, body image concerns, adverse reaction concerns, record keeping is very high maintenance, financial mistakes and myths, body autonomy, and the biggest barrier, I think, is the loss of caregiver spirit. We've seen it, we've felt it. It's so overwhelming sometimes that it's a barrier to vaccination. So I thank all of you for listening to this and giving me the opportunity to support all of you in vaccination, and also give you some ways that we had a lot of success at Ecumen. Thank you. Any questions?
Yeah, thank you, Tracy. You have done your company, you and the company has done a lot in regards to, making the pandemic. You made it seem like it was just nothing. Yeah, but no, you did so much, and it just shows by the support that you have with your corporation. Yeah, does anyone have any questions for Tracy? And while you're thinking of those questions, um, Tracy, I kind of wanted to go back to something that I want to make sure I heard it right. You or the company is setting up an infection prevention is my intention program. This is like, is this a new program that you're going to be delivering to all of your staff? Is it just for nurses, CNAs, or what does this look like that's different maybe than some other programs we already use?
It is going to be, it's for Ecumen wide, for everybody. And, you know, infection prevention is not focused only on the clinical departments. It's, you know, it's everybody. It's even administration. You know, if they're not washing their hands and they go onto the floor and, you know, shake people's hands and talk to residents. I mean, it's really everybody's responsibility. Infection prevention is my intention, should be everybody's intention. So we're going to be, you know, putting out a monthly message, focusing on different areas of infection prevention, and giving people a lot of, you know, holiday tips, health tips, you know, how to wash your hands, all of those types of things. Talking about MDROs, talking about UTI prevention, all of those high risk factors that might come in play. And you know, just doing some fun engagement things at the communities, you know, using a QR code that would bring you to, you know, a picture of a germ, and then guessing what the germ is and what it might do, you know, if it gets into your body. So just fun stuff like that to keep people engaged, and also to keep that that super important, you know, concept of infection prevention.
Are these different? You always you intrigue me when you say games, because I think we have such fatigue in infection control and PPE, you know, fatigue and so on and so forth, that making something fun will at least like lighten things up, and you have a more willingness to, you know, comply when you're like, that was a great example. Now, would you be doing this? Is this something that you would find on that Ecumen app that you have? Is that where you would be putting this out to the staff? Is that like how that would go?
Yeah, Ecumen app, and then also, you know, emailing out posters, you know, for the IPCOs and director of nurses to put up at their site. One fun little project, if I may,
Please.
that, well, Infection Preventionist Week is coming up. It's in, I think, October 14th or something around there. So I put together a toolkit for the IPCOs to use for that week, with just some snacks and prizes and stuff for all the team members. And it's for the whole organization, or all the departments, not just clinical. But I put together a little thing that says, we're missing a germ. There's a germ missing in our facility. And so I just made up a little, you know, like paper germ. And so the IPCO is going to take that, hide it within the facility, and then whoever finds it will come back to the IPCO. They can discuss infection prevention a little bit, you know, get some engagement there, and then they get awarded with a little treat.
That's kind of fun. Are you going to hide it somewhere where it might not, cleaning might be missed?
Well, it's up to them where they hide it, but, you know, it's just little things like that that can keep people, you know, a little more energized.
Sure. Oh, for sure. Anyone else have any questions for Tracy? If you don't want to put anything in chat, please feel free to just unmute yourself and maybe talk about what types of different strategies you have done in your facility to keep things, to kind of keep things happy, right? Things to still get your point across, but yet keep morale up. I think those are a couple of good examples, Tracy. Does anyone else have anything they've been doing that could help strengthen morale, but yet keep the message going?
And Tracy, I just wanted to add, I liked the idea and how you sort of did you kind of spun things. The wording is you called individuals COVID caregiver warriors. And I really think that's an important aspect. As you mentioned, sort of that fatigue that our care teams are feeling. And I think sort of spinning that and that sort of recognition that infection prevention is for everyone. So I think that's really sort of one of my takeaways from everything with COVID is that infection prevention protocols in place shouldn't be limited to a clinical setting. It's actually every organization should have something in place. And so I think that's really important to think about. And I like sort of the way you sort of strategize this. It sort of reminds me of sort of that sustainability piece. So we're thinking in broader terms of infection prevention. You're engaging everyone in the organization. And like you said, it's, as Kim mentioned too, sometimes it's hard to feel like you want to make it fun because it's hard to get up in the morning and just be excited about this. But the reality is it takes everyone to do this. And I think what an amazing culture that your organization has in place. A question that I had for you is sort of, has this always been the culture at Ecumen, or did you sort of, your leadership sort of rallied, once COVID hit and said, we're going to start doing this differently, or was that sort of the culture within your organization pre-COVID?
I would say it's the culture of the organization. I believe that, we're a nonprofit business that really puts people first. You can feel it all the time, the way that they think things through and implement things that are for the team. It's really for the team. It's for the residents too. But the team, if we didn't have the team there, we wouldn't have anybody take care of the residents. So it's so important to focus on them too. The COVID caregiver warriors, that was something that I did on my own. It was a little morale booster, I guess, if you will, that I did at a community. I got those, those little rubber bracelets that you can wear. You can get them really cheap. And I had COVID caregiver warrior printed on those and handed them out to the team members. You guys, they wore them for months, and they would hold them up, to each other like, yeah, we're doing this. We're COVID caregiver warriors. They loved those bracelets, and it meant something to them. Like, we're here, we're together, we're going to support each other. It's been a long journey. It really has. And I don't know. I mean, the commitment that people have had to this, to healthcare, but also long-term care, is pretty amazing.
That's really cool that you had that idea. And like you said, even just those little bracelets. So it doesn't take much, and it wasn't a pizza party. I mean, I'm not saying that, but that seems to be that it was like the fad was everybody had a pizza party. But I really liked that you just sort of said, let's just think outside the box. And it doesn't have to be much, but it's that recognition. But even as an organization, I think that speaks volumes when you have sort of that component of family helping family.
Yeah.
Because I think in the beginning of all of this, it was sort of like, to stay home and that ability to be able to be home with your family and not have to worry about everything else. So I think it's sort of, again, speaks volumes for an organization. And I'm just curious to hear if anyone else on the call has similar experiences within their organization that they would like to share.
Well, while people are thinking about that question, Tracy, some of the things that you mentioned, the smart sheets to request supplies and your weekly newsletter. We were talking about Ecumen today. How about the Zoom huddles? Actually, some of them you said you still do. Was that were a lot of these things already in place prior to COVID and then was kind of just enhanced? Or was this just fly by the, not really fly by the seat of your pants, but things were moving quick. So a lot of these things that happened were just freshly new, started at Ecumen, and now do most of these interventions, do they still exist?
Yeah. Yep, they still exist. Yep, all of these things were created, pretty quickly, but enhanced over time as well. The PPE thing, I mean, people were just in a crisis. You can't get gloves, you can't get gowns. What are we going to do? We can't get masks. And I mean, Ecumen just put so much effort into scraping, the universe for supplies. And like I said, we each community had to, and this is, including assisted living, memory care, independent living. I mean, all of the ways that we are serving seniors with housing and living, submitted their count of their supplies, and we calculated burn rates and things like that. But if they requested, hey, we could really use gloves, or we don't have any, bleach, or whatever it is, Ecumen would literally ship it to them in 1 to 2 days. Like, no questions asked. Oh, you need it? Okay, we've got it, and we're going to send it to you. Like the corporate office, which is located in Shoreview, was just loaded with supplies.
Good.
And that's what somebody did, was send out supplies.
Oh, wow.
But that's an incredible, source of support when you're struggling at the community. The other portion was, just the piece of communication, with the families, when there was the lockdown, the families were so upset, and the residents were upset, and team members were scared. We have an incredible communications department that would put together the right talking points, or put together, really important, letters or pieces of information to give to all the people involved. Was really a big load off our shoulders, so that we were saying and communicating all the right things at the site as well. So just a incredible amount of support all over the place. The corporate team at Ecumen is innovative, they're smart, they're efficient, and it really feels like they think about everything before they put things out, but they don't leave communities struggling. Like, what do we do next? Or how are we going to manage this? Like, there's always support out there. You never feel alone.
So Tracy, what would you say the nursing homes, the Ecumen nursing homes, short, long-term care, what's the biggest challenge for them right now? Or some of the biggest challenges? And I guess my second question to that would be, because you talk about innovation, I can see, yes, Ecumen definitely has that innovation mentality. What kind of things are you doing in those areas that you're going to tell me about?
Yeah. Well, I think the biggest hurdle right now is just, burnout, just PPE burnout specifically. Just the masks, and it just creates such a barrier, with communicating, and just, facial expression. And it's just something that has really become a barrier to everything. But, with all of the extra PPE use, the quarantines and the isolations, it gets tiring. I mean, before, when we had like an isolated case of C. diff or a couple of people with norovirus, I mean, that was reasonable. We could manage that. But, all of these quarantines and isolations, and, the gowns on and off, and the call lights going off, and you got to put everything back on, it creates a lot of, I think, just feelings of being overwhelmed and stress. And then, there's a staffing crisis out there. Ecumen has, we've been using agency. We are staffing to the best of our ability. I don't think anybody really goes short staffed, because everybody, the team helps out to make sure that doesn't happen. But it's just a sense of like not stability, with all of the staffing numbers. It's just hard, but we've retained like the best healthcare caregivers out there, and they can, continue to show up every day and lead the team and lead the new hires also. But I think some of the innovative things that have come along, what I do is I go out to each community every month and do audits. And I do audits across the board. It's not just clinical. I do EVS, I watch the housekeepers, I watch dietary, I watch everybody. And any gaps that I see or things that need to be worked on, then that's communicated to the leadership team so that those things can be worked on. I think there's just a sense of complacency and just people trying to get through the day sometimes. The pandemic has really been difficult. We all know that.
Yeah, there's no magic answer.
No.
Anyone in our audience, have you come up with some, I don't know, somewhat effective interventions on staff retention, empowerment, anything that you've done to maybe, yes, Tracy could use some pointers to send her way too in regards to empowering staff and PPE compliance.
So Tracy, I will share, there is a community in Western Wisconsin that while their work group sort of focuses on hospital readmissions, they actually have created a couple of different subgroups that are actually looking at the staffing issues. So they're beginning conversations with the high schools for the CNA programs, as well as the local colleges, and sort of talking about strategies on how to increase, just sort of that nursing awareness, and then sort of what sort of other continuing education can they do. So if they start out as a LPN, how can they sort of help to track those, sort of move them through the track to get them to be a registered nurse. So that is just one of the strategies that one of the communities in Wisconsin is working on.
Yeah, we do partner with a lot of community colleges for new hires, and also Ecumen really supports growth. We have a lot of scholarship opportunities for education. It doesn't have to be even healthcare related, but they do have a lot of scholarship opportunities, and they do support growth. We love to promote within. I've seen a lot of people go from, CNA to, up to, nursing, up to a leadership role. They do really support growth. So that is a huge point of retention in my mind as well, for people to kind of latch onto. This is a huge opportunity with this company to stay.
Well, does any of my other Superior Health colleagues, do you have any other questions that maybe Tracy could answer or we could ask our audience about?
So Kim, this is Kelsey. I don't necessarily have a question, but I'm just so grateful, Tracy, for you coming on and sharing your experience at Ecumen. And I think, listening to this conversation, one of the sort of big takeaways for me is just the culture piece and, all of the things that you guys have done pre-pandemic to build this really positive, collaborative culture across all levels of staff at your facilities, I think really goes to show, the strong impact that can have in a time like COVID. And I think even listening to you talk about, yes, you're still, in staffing shortages or crises, but just that has had some sort of impact with the retention and, growth within the facility. So I just want to commend you and your team for all of the work that you guys have done and appreciate you sharing that with our group today.
Thank you.
Well, with that said, Kelsey, could you possibly put the slides back up again just for a second?
Sure. Give me just a second.
Sure.
So Kim, we did have a comment come in the chat.
Excellent.
So Angie shared, I'm struggling with the ultimately implementation of the new EBP's requirements. The staff is so tired of PPE. Now we are adding more requirements. I fear that when they begin to see so many individuals on various types of precautions, they will be confused or complacent. Trying to remain positive, educating, etc. But goodness, I do feel my staff's pain, especially with the staffing challenges that we are all facing. Any ideas, any great ideas out there to keep things positive? So Angie's asking her, all of you as her peers.
Tracy, have you been working on that since that came out?
I put together all of the things that need to be addressed. And we're doing that because it is a really big undertaking, because even boiling down to resident and family education. Why are we doing this?
Mm-hmm.
And then, the implementation of how to maintain it and who's going to be, the person that decides. It's a lot, because they're even saying wounds and
Mm-hmm.
anybody that's more vulnerable to the risk of infection. But it is a huge undertaking. And I agree, it's a huge concern, not only with PPE burnout, but also cost. Time is a lot more work, a lot to consider.
Does anyone else have any good advice for Angie? Great ideas that keep things positive. I'm sure there has been things that you've all have done within the last few months to engage staff, to put a smile on their face, even little things like that, just a stupid joke walking by, but yet keeping them there, knowing why they're there, even when we throw enhanced barrier precautions on them. Yes, I'm rambling because I'm trying to see if I can actually muster up someone to think of oh yes, I know what we did. We did this, that kind of helped, or we did that, and that did spark some interest.
Well, and as I'm reading Angie's the comment again, I think that sort of that fear about complacency or confusion.
Yeah.
And I think just that continued conversation with your staff as to the rationale for what's being put in place. I think you can't over educate or overshare that importance of why you're doing this. I think that's really where they become complacent or confused, is when it isn't sort of rolled out to everyone and they don't have a clear understanding of why are we doing this now. So I think, maybe go back and as you're thinking about it, maybe sort of pull up these slides from Tracy again and go, okay, so what did Ecumen do again? Or, maybe we could even just have Tracy come back. But just to kind of talk through, like, what are some strategies, to be able to do that. But again, you're right. I think it's just really sort of, how do you keep things positive? And I think just making sure you keep those lines of communication open for staff and your residents is probably going to be key.
We do have another question in chat. What is everyone doing about the change in the CLIA waiver and no longer being able to test asymptomatic people with antigen tests? I realize we are no longer doing routine testing, but lost my thing here. That we are no longer doing routine testing, but we still need to outbreak test and test new admissions. I was listening to Leading Age yesterday when this came up and I didn't catch all of it. So I'm going to be honest with you, I'm not totally up on this at the moment. If anyone is, could you let me know, let us know exactly what the new CLIA waiver entails? And it might be easier just to unmute. Nick, maybe you could unmute and tell us the ins and outs of this new CLIA waiver. I mean, as in no longer being able to test. Okay, so we got the CLIA waiver no longer allows us to do any rapid COVID testing at all. That was not what I understood, but I may have read it wrong. That's what Jennifer says. And we got the QSO 2225 CLIA. I have no voice today. That's fine. Tracy, are you up on this? And it's okay if you're not.
This I have not heard about yet, but I'm aware that we don't have to test asymptomatic, but I understand what you're saying with the admissions. We would have to test. So I would have to look. I will be looking at this when we when we hang up. Did this just come up yesterday, Nick?
Yeah.
Okay.
Yeah. Like I said, I had overheard some of it in Leading Age, but I didn't get the whole gist of it. With the rest of the group, the others on this call, are you feeling just as confused and would like more information? Okay, we got here's the link to the new guidance. Excellent. Kevin says, heck yeah, please. Well, I added the heck yeah, but I'll go with the please for sure. Yep. Thank you for sharing that revised QSO. From the first paragraph, CMS issues this memorandum to rescind the enforcement discretion under the CLIA related to the use of tests on asymptomatic individuals outside of, sorry, I keep losing this here, outside of the test instruction for use. As home testing is now widely available and tests can be provided within the parameters designed to ensure accuracy. The original justification supporting this policy is no longer compelling. Yes, I am very confused. Yeah.
And Kim, I'm just reading really quickly and trying to grab some out of it,
Sure.
but it sounds like maybe this would be a good subject for future.
Yeah, I was thinking the same thing. That's why I asked. I mean, I know that we have of course, a already scheduled topic for next week, but that doesn't mean that maybe we could put our heads together and just put a little, maybe, give a couple slides next week to see what we find about this new ruling. I think that would be a good plan if I can get everybody else on board with that. I like the nods. I'm seeing my colleagues nod. So we can do that, come back next week, and we'll see if we can have some more answers for you.
Yes, testing as an overview, there's a lot of different things happening now. So
I know.
and it's a big part of what IPCOs do. Collaborating and making sure all of that gets completed and the requirements for reporting, tracking.
All right. Just also, Jennifer's, many of the home tests have clearly shown to have false positives, and this also does allow for staff to call and report that they have COVID just to be off work. We always required them to come in to do the rapid here, and then if positive would then do the PCR to confirm. We have Janae, facilities can meet the testing requirements through the use of your rapid point of care diagnostic testing devices or through an arrangement with an offsite laboratory. And you can go on to finish reading that. Yep, okay. And Kevin says the modifications to staff and visitor screening requirements needs clarification, please. All right. Anything else? Well, with that being said, it looks like the Superior Health team is going to do a little homework over the next week to add some more information for you on next week's call. Also, I just wanted to point out our upcoming roundtable events. You can see here are posted on the slide. I don't have the actual dates next to them, but this is what we are going to be discussing within the next 5 to 6 weeks. Could I have the next slide, please? Also, I just wanted to put out there, if you have any questions regarding the National Healthcare Safety Network, or all of us, we know it as NHSN, Superior Health Quality Alliance, we have a module called, I shouldn't say a module, it's a peer-to-peer learning platform called Connect, Superior Health Connect. We've talked about this before, but we also have a team that is open to ask for you to ask any questions that you have about NHSN. If you join Superior Health, all you need to do is plug your question in, actually right in the right where it says, I think it even says it right on here, but it's too small that I can't even see the darn thing. Hold on here. Yep, share what's on your mind. And if you just plug in what your question is regarding NHSN, one of the team members from Superior Health will get back to you with your question. And if you could give me the next slide, please, Kelsey. If you're not on Superior Health Connect, here is the link for you to do so that you can, again, easily reach out to us with any questions that you may have. All right, did we see another message come in here? Nope, just the survey. Okay, thank you, Jerry, for putting that in there. So before you leave us, could you please do me a favor and fill out the survey that has just been put in chat? And I hope that everyone has a great rest of your day, and we will see you all next week. Thank you again, Tracy, for being here with us. I appreciate it.
Thank you so much. I really appreciate having this opportunity.
Okay.
Thanks, everybody.
All right, bye-bye.